When I first became a library worker back in 2003, I did take an oath that in the event of a disaster, that I would serve as a disaster service worker.
I knew that I would be called on if there was a major catastrophe. Nobody ever thought we were going to be going through something like this.
Right now, I'm on assignment for disaster service work. I'm doing contact tracing for the Department of Public Health.
In California, thousands of government employees are now working as COVID-19 contact tracers, and librarians are part of that effort.
The governor wants to train up to 20,000 contact tracers. The people who are being trained now and in this first wave of 10,000 are repurposed government employees.
We get a list of people who have tested positive or who have been exposed. We give them a call and we check to see if they're okay, and then also to see if there's been anyone else that they've been exposed to.
Really, you have 3 days to find people, to get them isolated before they develop symptoms. So there's a time is of an essence. You go, you get a test, you turn positive, your data come into the health department, somebody calls out to you and says, are you sick? Do you need to be in the hospital? And then they get into their contacts as part of maybe an hour-long interview.
I go into my library at least once a week to change the space because I usually do it at home. Now, usually it'll come up as either an 833 number or it'll come up as an unknown number. But hopefully down the line, we can get it to actually say Department of Public Health. And then if we don't get an answer, we do have our scripted voicemail messages that we can leave. Since I am bilingual, I like to do it in English and Spanish. Being a librarian, it actually works for a contact tracer because this is what we do. My usual day at my library would be people coming in and asking me questions and needing information, and I help them out.
We love librarians who are used to talking to all sorts of different people. They understand how to solve problems. They understand how to refer up the line. They can keep track of things. They're almost ideally suited.
At first, I was really nervous calling people up and talking to them about situations. It's so sensitive, but everybody's actually been surprisingly very pleasant.
The calls have been everything, positive, negative, no answer, callbacks, angry callbacks. Some of them have been questioning who I am. Why am I doing this? Why are you asking these questions?
Most of the frustrations really come with people not being able to answer the phones, and that adds to the workload quite a bit.
From the people that leave voicemails, maybe half of those people will call me back. And unfortunately, after 3 days, I have to move on to the next cases.
California was the first state to enact stay-at-home orders. It's now seeing a surge in new cases. The spike is being traced back to around the Memorial Day holiday, after the state began its partial reopening.
So I'm looking at my cases that I've been assigned today. Currently, I have 9. Some of them are left over from yesterday because of the load that I had yesterday. I couldn't get to all of them.
You go in a day expecting to make 10 calls, and then it explodes to about 20 or 25 calls because of contacts. Your day can get a little overwhelming.
Busiest day, I had 30 cases, I believe. I couldn't get to all of them. And then you start going deeper and seeing the ages from 85 to 1-year-olds. It can be mentally draining.
When I go to the market and I see some people walking around with no masks on, I do think to myself, it's like, oh, we're going to have a lot more work to do, a lot more people that we need to contact. There's going to be a lot more sick people.
This is our opportunity to help. The numbers have increased, but that doesn't mean that we stop.
I feel like I'm doing a small part in helping slow the spread of this virus and this pandemic.
If I can tell people anything, is like, please answer the phone. We really want to just reach out to you and try to help. We really just want to stop the spread of this. There's no option on this information we get saying. I oversee a team of about 7 other library workers. And what we do is we meet in the morning around 9 a.m. And then I get a list from the Department of Public Health with the cases and the people that tested positive. And then I go ahead and I assign them to my team. We're just going to review a couple things on contacts. I'm not going to give any specifics, but I wanted to show you guys where you'll find your contacts. And then if you have any questions about the scripts, we can go over it as well. We have grown since this all started. I started off with, we were 5 full-timers, but now we're getting 3 new part-timers who are going to help us out a lot.
The average call time is about 40 minutes. If they have contacts, it depends if they're home. If they have contacts with them, we can probably knock it out all in one call. If they don't, usually we'll get their contact information and we'll make a separate call.
I need to get a hold of that person today. And that could stop a trip to the grocery store and stop a visit to a parent's house, something to that degree. That's the way I look at it. So if I can get to them as soon as possible, I may have prevented somebody else from getting sick.
We do what we can. If we got to do it for a while, we got to do it for a while. I'm here to help. I'll be here as long as I'm needed.
I do like the job, but like every other job, it is a job. And there are certain things that do come up, like negative calls, that you can brace yourself for, but you can only brace yourself so much. I do like contact tracing when I get that one person who's very appreciative for the call, for the information.
You know, we're calling them at some of the worst times of their life. So it can be scary for some. I have had some who have been very upset, scared, and we do the best we can to, calm their fears and show that we're there for them.